So I disagreed with the prompt because I don't think we should seek pharmaceutical treatment because I'm against pharmaceuticals. You're just going to ruffle some feathers, but I don't believe in depression as a mental illness or a mental disorder. I believe in it as an experience that is caused by external factors that are in your control.
So I used the wrong word here. I meant to say internal factors that are in your control, such as your physical health, your spirituality, your knowledge on how to make money. And the external, I just mean of doing those things outside of your mind, such as going to the gym, going to your job, talking to someone in person.
And if you guys say, oh, he's bullshitting, I have a bachelor's in psych, a master's in counseling, I decided to not do the therapy path because I didn't believe in those practices.
Some people lost their mind when I brought up my credentials. And the reason I brought that up is because if I don't bring them up, people will be like, oh, do you have any credentials to even talk about this subject? So that's the reason I brought up. But it doesn't mean I'm an expert in the field. So I'm just giving you my opinion on it. And I also know how depression is diagnosed, so I do have some expertise within that, and I know how easily it is diagnosed and how overly it's diagnosed.
So for anyone that's experiencing this, it's all external factors, and I'll ask you guys this, whoever believes in pharmaceuticals, for the chemical imbalance that's been proven wrong for 30 years.
Once again, it's internal and external factors, and I don't know why I said 30 years. It's actually been about 10 years that it's been debunked or questioned numerous times and not backed up by significant amount of evidence.
Did you ever get tested for your chemical imbalance before you were prescribed pharmaceutical drugs? The answer is no. You did not get an fMRI. You did not get a urine test or a blood test that tests serotonin. You did not do a PET scan that does to monitor the serotonin within your brain.
So a blood test actually doesn't test serotonin within the brain, but I do believe everyone should get a blood test before getting prescribed any antidepressants to see if they have any other chronic health conditions. As far as a urine test, it can measure the overall serotonin within the body, may not be a good measurement of the serotonin levels within the brain, and a PET scan and fMRI can measure the levels of serotonin within the brain.
So I'm just letting you guys know these are pushed on as a way for Big Pharma to push that depression is real. And I just believe it's an experience that everyone will experience differently, but it's not something that you can't control. And also, if you don't believe in it, how can it be real? If I don't believe in it, because you can't objectively measure it. Yeah. It's a psychiatric opinion, and it's a doctor's opinion, and there's no objective way to measure it.
So people lost their mind when I said this, and they're not critically thinking about what I'm saying. There is no objective way to measure depression. The way they measure it is based off subjective questions such as the PHQ-9 or the Beck Inventory Scale, which is all subjective. My point is there's no objective way to measure it, so I don't believe in it. Also, I was diagnosed at 18 with depression. I didn't believe it for a second, so everyone that says, oh, you've never been through it, I was clinically diagnosed.
What would you say to a man, though, who is in a, subjectively in a state of depression, if not seeking treatment?
I said I'm fine with seeking treatment, just not pharmaceuticals. I'm against pharmaceuticals.
So for depression, the chemical imbalance theory is not supported by any concrete evidence. Also, they do not test for this chemical imbalance before prescribing these antidepressants. And then lastly, they've done numerous studies showing that antidepressants work marginally better compared to placebos, but placebos don't give you the numerous amount of side effects that antidepressants do.
So your first thing for anything, if you're feeling depressed, is you do the 5 components of your physical health: your diet, exercise, sun intake, hydration, and sleep. Those are your first 4. Then you could go to spirituality, you go to accountability, routine. You could fix your social connections.
So some people really dislike that I brought up spirituality in this. But the reason I'm saying these things is because I'm giving you advice that you should look into all these different components of your life before thinking that there's something wrong with your brain, because your physical health, your financial well-being, your social connections, your spirituality, your accountability and routine, how you intake social media, all affect your mental health.
But you don't need a drug to tell you to alter your brain to tell you have a disease that's not objectively measured.